All right, so we're going to be doing a report on 4 patients, and 2 of mine are from the PICU, and the other 2 are from the NICU. So my first patient is 13 years old. She's from the PICU. Physician is Dr. Bati. She arrived to the PICU on October 18th and arrived to the hospital on October 15th. She has latex and adhesive allergy and a cinnamon allergy, and she has anaphylactic shock to those allergies. She's full code. She came to the hospital for a spinal correction of neuromuscular scoliosis. She's A&O times 1. She's on bed rest. She's NPO and has spinal percussions right now because she just came out of the procedure. So we're in the first 72 hours right now. She's on room air, and her urine output is positive 560. She has a 12 French G button. And the patient began to throw PVCs for about 2 hours and also spiked a temp up to 38.1 degrees Celsius. So we ran a few labs, including urine tests. And her calcium was a little low, so the physicians ordered calcium, but we have not given it yet because we're still waiting. She was positive for ketones in her urine. We also did an RFLAC for the pain scale. She was in a lot of pain, moaning a lot, thriving, moving around, just looked uncomfortable. So the physician gave an order for PRN oxycodone. And it's managed well. She responds well with it once given. And the family is updated at the bedside. The mom is in room, so whenever we go in, if she has any questions, we answer them, and we make sure to educate her on like what's going on, and the things that we're doing. She's pretty well educated because they've been to the hospital quite a few times due to her history. Her dosing weight is 31.8 kilograms, and she currently has a wound vac right now, and we haven't gotten any drainage out of it. She has a PICC line, an RVA PICC line. And it's double lumen, so the red lumen, it has TPN and lipids going at 6.7 milliliters per hour. And the purple is right now is saline locked, it's capped. So we're waiting, like that's just, it's an open line in case we need to push medications through. She had a right and left forearm IV that was saline locked, and we were monitoring it, but whenever the physician ordered calcium, they also ordered potassium due to the PVCs, and we were giving the potassium in the part, was it the purple line? No, we gave the potassium in the red line, and the pharmacist, whenever we called, said it was okay, but it turned out it wasn't. It actually blew the IV and the vein, and it was blanching. So we had to discontinue that one, and we were already concerned about the other one, so we went ahead and discontinued the other IV as well. She has a history of epilepsy and cerebral palsy. All right, so that's it for her. So the next one, I have a 3-year-old boy in the PICU. His dosing weight is 12.2 kilograms. He arrived on October 18th. He is currently on high flow with a nasal cannula, 10 liters at 30%. He came in for respiratory distress. We currently don't know why. His cultures came back negative for like bacterial stuff. So I think they're waiting to run another CBC because they have a CBC planned for 2 days later. The physician is Dr. Smith. He has a PIV in his right hand. It's 22 gauge. He's NPO and in bed. A&O times 4, knows like for a 3-year-old, like knows where he's at, what he's doing, like who he is, who his mom is, like knows that he's sick. So there was no labs. He's not in any pain. We use RFLAC for that as well. And that he has PRN Tylenol if needed. He responds well to weaning on the oxygen. So we moved him from 10 liters to 8 liters, and we are planning to move him to 6 liters in a few hours. He was also moved to clear liquids, so we gave him some Gatorade to see if he can get some of that down so we can get his output up. We educated the mom at the bedside, and we plan to move him to the PACU within the next 2 to 3 days. All right, so the next patient is in the NICU. She's 38 weeks and 4 days. She came to the hospital for a premature birth. She arrived on 10/15. Her dosing weight is 2.4 kilograms, and her physician is Dr. Landry. Currently has no known allergies, full code. She was premature at 30 weeks, so she's been here for about 8 weeks. Right now her urine output is 4.63, and she's positive 134.2. She has a nasal cannula for 1 liter, 21% blended. Head of bed is elevated. Breast milk goes through her NG tube at 48 milliliters per hour, and the NG tube is currently sitting at 20 centimeters. Has a kcal of 120, so that's the goal that we need to meet. She has no IV, no labs upcoming. We are weaning her to room air, and she's tolerating pretty well. She has diaper dermatitis. It's pretty excoriated, red, pink. She was bleeding at first, but we began crusting and to put like a diaper cream. And she began to improve later on each time that we changed her. So we're still monitoring that. She doesn't have any pain. She had emesis. So we moved to 48 milliliters over 90 minutes instead of per hour. Just to see if we slow down the feed, if like her body will process the feed differently. We also moved her to safe sleep, so the head of bed is no longer elevated. We took everything out of the bed as well, and she's on her back. She's supine. So the patient mom was updated twice. She wasn't in the room, but she did call for information, and she called right after rounds and later on in the evening. All right, and so my next patient is also a NICU patient. He's currently 3 months. He's 3.7 kilograms. He arrived to the hospital on July 10th for a premature birth at 25 weeks, and he has a twin. Also, physician is Dr. Landry. He's full code, no known allergies, 4.48 urine output, positive 138.26. He has an endotracheal tube in line at 23 centimeters. He's sitting at the gum. It's gum at 9.5 centimeters, and it's centered, and it's taped right now. And he's on 56% FiO2. His PEEP is 9. For suction, we go to the double loop blue at 21 centimeters. He has a 6 French NG tube in the right nostril, 23 centimeters in. And right now we're aiming for 90 kcals. We're feeding him EPF 30, 22 milliliters over 45 minutes. He also has 5 milliliter prune juice twice a day. He has a PIV 20 gauge in his right arm, and he has a right SAF pick right now. So it's a single lumen, but there was a trifuse and a bifuse, and we're running nasal saline, normal saline, Precedex, heparin, and morphine Q3. We're also on contact precautions for serratia, and he had a PDA, and he recently had a surgery to have it coiled, but when we listened, we were still hearing a murmur, so we're going to discuss that with the doctor. He also has diaper dermatitis, and we began crusting because they were already putting diaper cream, but the wound was pretty open. It was more than bleeding. It was like an open wound. So we began crusting, and we're documenting that for each diaper change. There's no pain, and if we check that from his vitals, and we see that he's in pain, then we can manage with morphine bolus at 555 mics. The patient mom was updated on the phone. She did call once in the morning and said that she was going to visit tomorrow. During the shift, we lowered him to 50% FiO2. Morphine remained the same, and we moved him to 43 milliliters over 90 minutes instead of over 45 minutes. And we basically doubled how much he's receiving and doubled the time. All right, and that is it for him. That is it.